I've had the privilege to work with brilliant staff, board members, and colleagues across the globe. But the most memorable experience actually happened not that long ago. In November of 2022, I had the privilege to travel to Ndola, Zambia, to participate in Amref's international board meeting, and had the opportunity to meet in person, face-to-face, with colleagues really for the first time from around the globe, people who share my aspiration, my inspiration to achieve lasting health change in Africa for the people of Africa. But while I was there, even more importantly, I had the opportunity to visit one of Amref's active programs. It was a program called Closing the Gap in Ndola, Zambia. And this is a program that's aimed at addressing high rates of maternal mortality and improving neonatal outcomes in the Copperbelt province of Zambia. And it was such an eye-opening and moving experience to be there, to see a program that has achieved so much. And it's achieved so much because it's completely community-driven and client-centered. It's focused on building enduring skills within volunteer community health workers to ensure that they are equipped to detect high-risk pregnancies and refer mothers to the care that they need before it's too late. It's highly collaborative, creating opportunities for care providers to work together, recognizing that when they work together, they produce better outcomes and deliver better care. It was focused on creating healthcare-seeking behaviors among women, and they did that by ensuring that pregnant mothers trusted the healthcare system and the healthcare providers that they were interacting with in welcoming healthcare environments. They were engaging men as full partners in safeguarding the health of mothers and infants. And so to see that in action, and even more importantly, to see the impact, is really inspiring. The clinic now delivers about 100 to 120 babies per month. And since the program started 3 or 4 years ago, it hasn't recorded a single preventable maternal death. And that is lasting health change. Well, this is a really exciting year for Amref Health Africa in Canada, because it's our 50th year in Canada. 50 years of supporting programming in Africa to ensure that we're advancing collectively better health outcomes and opportunities for people across Africa. And over that time, Canada has been able to deliver tens of millions of dollars in support from the government of Canada, from the foundations who support us, and from Canadians across the country to support that programming. And we're so fortunate to have to benefit from the generosity of Canadian society for the programming that Amref delivers. But I think it's really important for people to understand that as long as Amref Health Africa has been in Canada, our 50 years, we aren't a Canadian organization. We are an African organization. Amref designs and implements programs with, by, and for Africans. The Canadian arm of Amref Health Africa is here to support, is here to provide funds, to provide guidance and advice where relevant. But we're really at the really servants of Amref, a global an Africa-led organization. And I think that, for me, is another inspiring part of the mission, knowing that the work that we're doing is being driven by, for, and with the people of Africa.